Good afternoon, everyone. Welcome, and thank you for joining us for this Knockout Opioid Abuse Day training webinar. I appreciate your patience and your persistence in participating in this rescheduled event after the power outages that affected, I know, so many of us across the state forced us to move this training. I know many of you joining us today have been part of Knockout Opioid Abuse activities in the past, so I thank you for your commitment, your continued interest, your involvement, but I also want to welcome and thank those of you who are here for the first time. I know we had over 500 registrants, which is very exciting, especially as we look at Knockout Opioid Abuse Day in a very different light this year. It is our 5th year. Knockout Opioid Abuse Day has been designated by the legislature and Governor Murphy for October 6th each year, and this is the 5th time that we are commemorating this event and coordinating it. And it's a statewide initiative to really mobilize and engage the prevention, treatment, and recovery communities, community leaders, concerned citizens, parents, students, to really raise awareness of the potential for dependency of prescribed pain medicine and its link to heroin addiction rates in our state, to help reduce stigma of addiction and to shine a light on the need for recovery, access, and recovery support. And this event has most definitely evolved over the past 5 years and will really continue to evolve this year as the event will turn completely to a virtual event. So there'll be no in-person activities planned or print materials supplied for in-person sharing of information. So while this year is the 5th annual Knockout Opioid Abuse due to the COVID-19 pandemic, it's going to be a very different type of event as we continue to convert all of our outreach to virtual. But I think there's many opportunities that come from that. And so our goal throughout this presentation is to really talk about what has worked and how we see it kind of converting and working, and also to get your ideas and to hear from you about what you think will work or what some of the challenges may be. So I'm joined this afternoon by Matt Birchenow from my office. He's the Partnership for Drug-Free New Jersey's Director of Special Events. And I'm also pleased to have with us Rebecca Alfaro, the Deputy Director of the Governor's Council on Alcoholism and Drug Abuse, and Barbara Kaufman, the Director of Prevention for Morris County Prevention is Key and their Coalition for a Safe and Healthy Morris. They're both key collaborators on this initiative, and over the past 5 years, we would not have achieved what we have achieved without their input and collaboration. And so I thank you both. And to speak about their contributions and collaborations, I'm going to invite them both to say a few words of introduction. So Rebecca, we'll start with you. Welcome.
Thank you, Angela. It's always a pleasure to be involved with Knockout Opioid Abuse Day. We've been very fortunate as the Governor's Council on Alcoholism and Drug Abuse has partnered on this event from the very beginning 5 years ago, and I can't believe how much this project has grown since the early stages of us kind of sitting around a table talking about how we would get that message out. And here we are 5 years later, and it's national, it's a national, it's a statewide recognized day, and we've really evolved this project moving forward. So I'm excited to be part of this again. I know our staff is participating as well, and we've had so many municipal alliance who have really played a vital, really participated as a vital component to the success of this day in raising awareness. And I want to thank all of those municipal alliance participants that have been involved in this, whether you have been doing this for the 5 years that this has been in existence, or whether you're new. The alliances do play a very critical role here. And I think the fact that you all have your finger on the pulse of what's happening in your community and the best ways to reach out and who to reach out to, who are those key stakeholders that you need to have involved and at the table. And I think that that's what makes this, this event such a successful event year after year, is because of that key component of you understanding your community. So we're looking forward to this virtual platform this year. I think that it's a great way, especially in the time of COVID and with the alliances just being able to have that opportunity to continue to reach out, continue to do their work virtually, continue to spread awareness, and all of that is going to be very important. So I look forward to seeing and hearing from you all on how you're doing that virtually within your communities. And so I will turn it back over to you, Angela. Thank you.
Thanks, Rebecca. It's very true. The alliances have been such key partners. So again, we thank you for your collaboration and leadership, but also for all of those at the grassroots level. Thank you. And so Barbara Kaufman from the Coalition for a Safe and Healthy Morris, this idea actually began from a meeting that Barbara hosted for her coalition that I happened to be attending. And we kind of continued to discuss, you know what, how can we get messages out face-to-face to people? And so while that has obviously going to change for this year, that's where the idea came from. And I know, Barbara, you've had so much success in your community for the past 5 years and have really been able to get large groups of people to participate and to share messages, but in very unique and innovative ways. So please, Barbara, introduce yourself and share your thoughts on the project.
Yeah, hi, Ange. Again, this is Barbara Kaufman from Prevention is Key, and I'm coordinator of the Community Coalition for Safe and Healthy Morris, which really is most involved with KOOAD. I'm so excited, like Rebecca, to have been a part of this from the beginning, and I smile, Ange, when I hear you, because I remember that so clearly, sitting in that little in our little conference room with a coalition meeting and saying to the coalition, you know, how frustrated we were that we couldn't do more. And I said, you know, we got to start knocking on doors. And Angela and Angelo were there, and of course, with their tremendous vision, they said, how would you like to really make this a knocking on door event? And so from there we went, and Angela and I were talking the first year. We were lucky enough to have about a little over 3,000 people, 3,500 volunteers throughout the state. And in the next year, it more than doubled to at least 10,000, and it's gone up since then. So it's really exciting. Morris County has been a big part of it, I know. This year will be a little different, but we're going to do all that we did before, but virtually. For example, we've always had an event noting Knockout Opioid Abuse Day, a theater performance, we call it. This year, we'll do it again. We'll talk about it later, but it will be virtual. We're going to continue our messaging. We've already scheduled some digital boards on Route 15, some big billboards digital that will have the Knockout Opioid Abuse Day message and hopefully get to many more people than we could have even before. Be again on our websites, our Facebook, our hospital. We've always been so lucky because Atlantic Health has always helped us so much in posting the messages in patients' rooms, in their newsletters, and that's exactly what we do too. Speaking of newsletters, they will be in all of our newsletters, our website, our Facebook, doing all we can. Still going to the pizza places because they are just about the only restaurants that have maintained business during the pandemic. So they will be including it on their pizza boxes again. All the things that we've done before, I'm excited about it this year because I know even with our regular prevention conferences, we've been reaching double the amount of people that we would have in person. So hopefully it's going to move bigger again this year than it had. You can tell even, Ange, with the number of people that are a part of this. So thank you all, and I'm excited about October and before. We're going to start pushing before. Good luck, everybody.
That's great. Thanks, Barbara. And it's true that history is so important to see how a grassroots idea has been able to really grow throughout the state and to get the attention of the governor and to really, make such an impact. And, we're going to continue that focus of educating physicians, doctors, dentists, nurses, all prescribers, and raising awareness, and educating New Jersey citizens and families. Now I want to introduce Matt Birchnow from my office. Matt is actually coordinating the project this year, so he will be your main point of contact, and he's going to take us through some of the slides. I'll be jumping back in, as will Barb and Rebecca, but please use the chat feature as we go along if you have any questions. And just again, a reminder, all activities this year will be virtual. So Matt, take it from here.
Thank you, Angela, and thanks everybody for joining us today on our second attempt, as Angela mentioned, with the power outage we had a couple weeks ago. So we really appreciate you sticking with us and your determination to be a part of this important educational opportunity throughout the state this year. Why should we continue to address the opioid addiction crisis? With all that's going on, it's sometimes easy to lose perspective on what's been going on over the past 2 decades in New Jersey and throughout the country with the opioid epidemic, and what we've seen sort of just reach such catastrophic and tragic levels these past 5, 6, 7 years or so in the number of overdose deaths state and nationwide, and the number of overdoses that we've seen. And in these last few years, we started to see a little bit of progress in a number of regards to the opioid epidemic. We saw some new legislation to limit prescriptions to the correct and appropriate times and appropriate levels. We saw the numbers of overdoses and overdose deaths start to tick down last year. And then with this year, we've had one big giant obstacle thrown in our way again in every aspect of life, but also in opioid and addiction crisis. And it's so vitally important to continue to get that message out this year with just sort of the backtracking that's happened because of the nature of this crisis, the isolation, the grief, the barriers to recovery, treatment, and prevention even that we're seeing now because of this. So it's it's just a reminder that more than ever, it's so vital that we get messages of education out to residents of the state to help them through the opioid epidemic as well.
Thanks, Matt. And, obviously, so important that we all understand, because I know as we go out there, all of you go out there and have this conversation. I know many of you have continued the conversation, right, about the opioid crisis, about the addiction crisis. People have COVID only on their minds. And so important to have that information and to understand why we need to continue this. I want to mention that we do have a number of recorded webinars that the Partnership for Drug-Free New Jersey's Knockout Opioid Abuse Town Hall Series, in collaboration with the Horizon Foundation, has put on since April, and they really address different aspects of the opioid crisis and how they're impacted by COVID. And so I welcome you to visit the Knockout Opioid Abuse.drugfreenj.org website and look in the webinar series at some of those recorded town hall meetings that we've had that really have experts speaking about this issue. And we have another one planned about prescribing at the time of COVID and the obstacles that Matt touched on, scheduled for this Thursday, a live presentation. But we also have a number of recorded from the past. So how can we continue to address the opioid and addiction crisis? And what are the challenges going to be? I mean, we know there are going to be challenges. We know, first of all, that many of you have already established groups of volunteers, right, who have done in-person events. We know door-to-door delivery of materials is not going to be possible. I know many of you have done that in the past, or coordinated groups to hand out materials. We know those face-to-face interactions and having those conversations are so important to make people understand why we need, to have this this conversation and continue to address and talk about the opioid crisis in our state. And really that visibility is really diminished by that inability to have large events. I know, many of you had events, whether they be on your courthouse steps down in South Jersey or on the Green in Morristown, and really had people come together, students, groups came together. I know we had sporting events. We had students who went out to grocery stores and handed out information, or other volunteers who handed information. And since that's not all going to be possible, we have thought about some other ways that we can really continue to get that message out. And so, Matt, I'll turn it back to you.
Thanks, Angela. That's, we know there's going to be challenges, but with this new format going virtual, we know we have opportunities as well. We've all seen it over the years, social media and online campaigns that are, just part of sort of the common knowledge now. Ice Bucket Challenge, other campaigns of that nature that, were effective and were great in spreading important messages. With the door-to-door and in-person interactions limited, we've worked on sort of the web presence in the past, and we've done well with that. Now, with all our energy focused in that one direction, I think that opens, out of necessity in a way, that opens up, sort of new creativity and new ideas to maximize, our effects with our impact with social media, with email, with web communication, websites, and that sort of thing. And we can even increase our reach in that way. That could, be beneficial to us. And it again, out of necessity, we're looking to, while October 6th is Knockout Opioid Abuse Day, we have to be proactive and kind of get out ahead of things and find our partners in the community, which we'll talk about in the next few slides, and sort of build that coalition within the community, which I know exists in a lot of places throughout the state, and I know has been a big part of this effort before. But I think it just places even more importance on getting more people involved, more people in all walks of life in our community to get them involved in this, which again, engaging new partners, whether it's in local government, community groups, scouting or other groups for youth or that do things in the community that are also sort of limited right now because of that lack of in-person interaction. We want to really work with them even more than usual to have them get that social media presence going. And we think there are opportunities in that, and we want to just think of the best way to get everybody on board early.
I think, Matt, that's a really good point. And really, as we think about like how we can get people on board, but then continue to educate them with information about prevention and treatment, addiction in general. Just we want to make sure people understand, and I think this gives us a different opportunity. I'm sure many of you have been on or scheduled webinars where there are so many people on. People have more opportunities or different opportunities, right, to participate in things that maybe they didn't have the time to in person. And so what we have decided to create a Knockout Opioid Abuse Day learning series, right? So we get information out. It's a little mini series of different webinars that will address different topics. We'll make them available to all of you so that you can share them with your, mailing lists or your community or your students. And so we're going to, we're partnering with Rutgers to do an opioid training. We're going to have a number of Knockout Opioid Abuse Town Hall webinar meetings, really targeting different communities. So some community level conversation going on, but also some state level conversation and different groups such as athletes, which I know Matt is going to talk about a little bit later. I know Barb and Rebecca both have events that they are going to be offering during this for this learning series. And so Rebecca, we'll start with you. I know Jakarta is going to be offering a training. Can you talk a little bit about it?
Sure. We had developed a training series. it was around spring to early summer last year in 2019 that we put together for the municipal alliances that are going to be participating in the program for this year. So those trainings are still available online. We have trainings, and I think that the one that would probably be the most relevant here for those that are participating is the capacity building webinar that we had put together. It'll really, I think, give some great information on how to build those relationships, who you should be building those relationships with, some ideas of how to do that, and how to really get the community voice involved. And so those webinars we have available. If you are participating in your municipal alliance and you have not have access to those webinars, you can contact your county alliance coordinator. And if you're not sure who that is, you can go to our website at gcada.nj.gov. And there's some information on our website where it lists the county alliance coordinator for your county, and you can find that information right there. So those county alliance coordinators will have the links available for you to view those webinars. If you need more information, please contact them. Thanks.
All right, great. And I think, Rebecca, if you could just add that website information to the chat so everyone
Absolutely.
can have it, and we can also send it out post-event so that everyone can get an understanding of what's available and how they can participate. So we'll send that out in a post-webinar email with additional information there. But it sounds like it's really a great starting point, especially for those who haven't participated in the past. So thank you for making that available. Barbara, I know you're really planning a great, I don't want to call it an event but a virtual event, the Healing a Beautiful Broken Mind. Can you talk a little bit about that?
Surely, I'm glad to. Last year, well, actually the year before, we started with our small songwriting contest and concert for Knockout Opioid Abuse. And I think maybe we had 25, 30 people in our recovery center and cares. Last year we stepped up a bit and we had a theater performance at CCM that was amazing, talking about people with addiction and seeking recovery or in recovery. This year it's going to be virtual, so you can see it will be a documentary about addiction recovery. It will include stories and music. Really, it's talking about the lives of many who faced addiction and found recovery. Michael Cavello, who you see on the in the ad, is a star. Known Michael a long time, and he is a star for real. Michael struggled with addiction for about 15 years, OD'd, and finally decided he had had enough and sought recovery. He has been in recovery now since I think about 4 years. Yeah, since 2016. And he shares his story through music and words that are incredible, as will some of the other people in the documentary. So you will be getting more information about it. We'll be showing it throughout October, but I think starting probably mid-year because it's a big project. But if you need any information or want information about it, just go to McPick, MC, P as in Peter, IK.org, and you'll find it. And believe me, we'll be sending out so much more to all of you. So I'm looking forward to that. Also, wanted to talk to you, Ange, and this is something I don't think we've talked about yet, but we are starting a Lunch and Learn series in October. So our first will be about aspects of the opioid crisis. Not exactly sure what we're doing yet, but it will be. So that will be part of what we share for Knockout Opioid Abuse. So that's it.
Oh, that's great. And I I've been and attended the in-person events that you've had over the past few years. They've all been just one better than the other, and just really a great different way of getting messages out. So I'm really looking forward to this next project. So we'll definitely share again the information on the website that Barbara mentioned, as well as any other resources that become available we'll be looking at, and I know Matt's going to talk about it a little later in more detail, but we'll really be keeping you informed of new opportunities, new campaign pieces, and new messaging that's available through weekly email updates. So, we really truly want to build on the success that has taken place over the past 5 years, and looking at this virtual way of doing that. And I guess we're lucky that Knockout Opioid Abuse Day, in a way, is in October, and that I know so many of us, since March, really have been in this kind of platform or learning or event planning, all online and virtually. And so I think we're in a good place in October where everyone's kind of used to it, so we're kind of out of that learning phase. And so as we look at building of success, specifically with our prescribers, in the past, the Governor's Council has printed thousands of prescriber guides that we've been able to give to our all of our volunteers, right? And you've been able to take that and go out and visit with your doctors and your nurses and your dentists, give them the information and have those conversations in person. And so, right, we're not going to be able to do that this year. So what will that look like? So we're going to be providing all of the materials, the toolkit, the resources from the CDC, the resources from the Surgeon General's office. We're going to be providing all of those virtually to you, digitally, in a toolkit. It'll be similar to the toolkit if you've participated in the past that you're used to, but it'll be different in that everything will be really divided up into who the audience is, and so you can go right, and it's kind of one-stop shopping. So there'll be resource guides, turn the tide information, and other additional resources and education opportunities for prescribers, including information about continuing education opportunities that are available, whether they be webinars that are available or reading material that's available. So we can continue to keep those resources updated so that then you can share those resources with the prescribers in your communities. So Matt, you want to talk a little bit about building success and continuing that success that we've had with local governments and what that's looked like and what we think it can continue to look like?
Sure, absolutely. In past years, we've had a tremendous amount of success with our participants throughout the state. They've talked to their mayors, their council members. They've even gone to county and state level officials and our friends at Community in Crisis in Somerset County. You see that picture on the bottom right. That was a congressman who came out and kind of joined in with the community in spreading this message. As we've belabored throughout this, we're not going to have those opportunities, those photo op opportunities anymore, but we do, and we know that we have people in mayor's offices, in town councils, in the county, throughout the state they're passionate about this, or they might not know a lot about it and they want to get involved. We can still reach out to them. We can send that initial email, that initial call, and say, this is a problem in our town, in our county, in our community. We think that it's important that you become educated about this, that you help educate your constituents about this. And this year, that's going to be for them maybe putting something up on the town website if they can do that about this. Maybe giving them some of the statistics in your community and asking them to tweet or post something on Facebook, so everybody that follows them, people in their community, they learn this, they're aware of this issue. In the past, you see there on the left, that's a proclamation or a sample resolution that we've created, and we'll update it for this year as well, that participants throughout the state have sent this to their council, and it basically gives the town an opportunity to say on record, we know this is an issue in the state and in our community. We're declaring October 6th in our town Knockout Opioid Abuse Day. It's a way just to lend that support to this movement and to this vital issue. So that's something, again, we're not going to have we're not going to be in the council chambers doing that this year, but they'll be doing their meetings on Zoom most likely, and as they've been doing, or whatever platform. And there's that opportunity for your town council members, your mayors to out in the open say, we need to address this, and we're working to address this. So that's an opportunity that'll be a little different this year, but it's important to get them involved for sure.
Yeah, that's a really good point, Matt. And as people continue to have those Zoom meetings, these conversations, and government officials can, these proclamations and such can continue. And as we look at different ways, right, to engage them, as you said, I know in the past, like, for example, I think the first year, Mercer County, you know, every door handle in the county building had a door hanger on it with a message. So this year it's on, you know, everyone gets an email, or it's on a website, and you know, the county, all the county staff gets something. So there's different ways of looking at it. And as we put things on websites, right, the message continues then to get out to the community, to our neighbors. You know, again, in the past, we've had such great success, and you guys have been so innovative in ways of getting things out, whether it be on people's car windows, or you know, at school events, or just having those conversations outside of stores. So just, you know, as we look at ways, you know what, let's start by using you know, our social media platforms, or let's look at our own individual websites, or let's ask our school community, right, to send an email out to all parents. And so if we look at different ways, we can maybe get a message out to even more people, right? Because maybe on foot we could get, you know, 200 pieces distributed, but if we send an email out and coordinate with our school superintendent, maybe, you know, we can get 20,000 messages out. So just looking at kind of the silver linings to the situation that we're in. And again, looking at our friends and family and really encouraging them as well to take those messages and sharing that information, or attending an event as part of the educational series, you know, really being able to get those messages out, and continuing to engage our youth, and specifically with service opportunities. I know so many, I have a niece who's in high school and she's prepping for college, and you know what, there aren't those service opportunities, those leadership opportunities have really dried up. So really tapping into the youth and the students to see, you know what, how can we engage with them to get messages out to their peers, to their school community, to their community at large, and how we can work with them to, you know, document the process so that they can get the needed leadership, or, you know, service opportunities that they may not have other ways of engaging in at this point. And I know we talk about students, you know, obviously, oh, is that Barbara? Did you want to?
Yeah, that's okay. After you, go ahead.
No, go ahead. I was just going to
Okay.
transition into
I
sports.
just wanted to add in, while I'm listening to you, our freeholders have always been really involved. They've even gone door to door with us to hang the door hangers. So I've emailed them to see how they can get the word out. I'm sure they have, you know, they have a lot of social media opportunity. I've also talked with the sheriff, who has also been very supportive, Sheriff Gannon, and he's asked me, and I think I told you already, Ange, if he can have at least 500 door hangers. He's doing the, you know, the old school way, and distributing them at his on his Hope One vehicles, because they're still in the community. Hope One is a mobile recovery resource service, and you know, they do Narcan trainings, they offer information, they do mental health and peer support. So Ange was generous enough to have the sheriff take some. So he's going to be handing them out in all spots throughout the county on Hope One. Also, thinking about, well, we're trying to get messages out in the back to school packets. You know, where we often put something in there from our agency. So this year, I want to include some knockout opioid abuse info. So I think that's a good, if you can work with your schools to get them in their I forgot what they're called, but their parent packets at the beginning of school, that reaches a lot of people. So that's an opportunity too. Thanks, Ange.
No, that, you know what, Barb, you're right. Really following kind of the eyeballs, right? Like, where are they and where can we get these messages out? Because people are spending a lot of time, obviously, when it comes to back to school. They may have other things they're worrying about. However, when they get that back to school package, they may be, reviewing that information, or in the workplace, or putting an email signature. So every email that goes out, in the month of October, will have a message on it, a prevention message or an education message. Really, or, again, encouraging people to participate in one of the learning activities, and really focusing right on the students in the way that, from what you said, Barbara, so that's really an excellent idea about engaging the schools and looking at different ways to do that, whether they can send something out in that parent packet, or put something up on their website or in their parent portals, or send an email blast, or do an auto call. But we know students, right, are impacted, and I know that throughout the past few years, we've had such great success in engaging, especially athletes, in sharing those knockout opioid abuse messages, and really getting that message out to athletes themselves, to coaches, to athletic trainers, and that. I know you've coordinated so much of that over the past few years. So do you want to talk a little bit about how you see that evolving?
Absolutely, yes. In past years, it's been a big success. We know athletes, they're susceptible to sports injuries, and with sports injuries, in the number of cases, in many cases, you have prescription opioids involved. And it's, in past years, it was as simple as showing up at arranging with the schools throughout the state to have a table at the high school football game, to have helmet stickers for the players, to have announcements at halftime about this issue with statistics and just facts to help parents, to help the students understand the severity of this issue and how it could eventually reach them. We're not really sure coming up this fall and throughout the whole school year what high school athletics will look like, whether they can happen in a safe way due to the pandemic. But there's still an opportunity to reach them. We know we still have committed athletic directors and coaches and trainers, as Angela mentioned, who want to address this issue with their student athletes and then the parents. We think there's still that opportunity if we get in touch with them and make our virtual resources, our virtual fact sheets and whatnot available to them to share with parents and their athletes. So we would recommend contacting athletic directors that you work with, or introducing yourself to them and having them involved in what you do. Whether you're an alliance or just a community group, getting involved in this issue. What we do have for sure, we know on September 24th, we've been working with NJ Cares, the Office of the Attorney General in New Jersey, on a series of webinars, and that day we'll be looking specifically at this issue as it relates to high school athletes, and we'll have someone from the New Jersey Interscholastic Athletic Association who will speak about it, a doctor as well, versed in sports injuries. And that's a good opportunity to share, with if you want to attend to learn more about it, or make that point that out to coaches or athletic directors, that they can be on that and see the issue and educate themselves. There's also a great program that has made its way throughout the state. We've been fortunate to work with, again, NJ Cares and the Attorney General's office and the Garden State pharmacy owners, and a number of other community and state level groups on the SOAP initiative, which is Stop Opioid Abuse Program, which has gone into schools with people very knowledgeable about this, to speak to athletes and other leaders at the student level. Of course, like everything else, we're adapting to a virtual platform for that, but that's something that if you're interested in for a high school near you, that could be a useful tool for you. And just to veer away from high school sports momentarily, I mean, there still are youth level sports that may be, going on to some extent this fall. Reach out to coaches or leaders of those programs too, and say, can we share this literature, this resources in some way with your parents, the parents of your kids, so that they know the dangers. It's important to reach everybody about this, but especially parents of youth who could be in the position a few years down the line where their child is having a surgery or something like that. So it's another avenue that is very important to reach on Knockout Opioid Abuse Day.
Thanks, Mike. It's so true. And I know we've had so much success, and you've coordinated with those Friday Night Lights projects, especially right throughout Bergen County, where we had such great response. And so the hope is that those partners will continue to engage and continue to help us get these messages out. And I know, and kind of going back to Barb's point earlier, that we do have a number of committed partners that we want to continue to engage, right? We know we have our pizza parlor owners. I know down in Cumberland County, there's a series of fast food restaurants that have been really committed to sharing information, the Hope One vehicles that are out there. And so we do have a very limited supply of print materials that are available. So if you do have those committed partners and you want to be able to get them something, please reach out to partnership directly. You can reach out directly to PDFNJ at drugfreenj.org, and we'll make sure that we coordinate with you to get that, those materials in your hands. Because we do know that a lot of the partners are so committed that, whether they be pharmacy owners or, again, small businesses who have stayed open, and with so much takeout and curbside pickup and things, there are many opportunities that are available. So if you do have a committed partner, again, it's a much more limited supply than what we've had in the past, but we can make those available to you. And of course, really looking at how we can continue to maximize our web presence and our, presence on social media. So I'm going to turn this back to Matt so he can kind of walk us through a few of the different strategies that we're hoping will work out.
Thanks, Angela. And some of this is sort of going over what we've talked about already, but just in a more concise way. If you're part of an organization, whether it's the Alliance or a community group, you have your own website. Obviously, it's a perfect moment to just put a notice about Knockout Opioid Abuse Day. We have art and graphics and other things that will be available in the toolkit on the website that you can just put in there, and it's a good way to have everybody know you're involved in it and what an important issue this is. As I mentioned before, go to your local government, go to the police, library, community groups, whether it's volunteer groups, youth organizations, churches. As Angela mentioned, the local businesses. These are all vital parts of a community. We know everybody wants to work towards progressing in this against the opioid crisis, and there's just the first thing, easiest thing with resources we provide is to put something right up on the website. So I think that's a first place where you'd want to start. Then emails, has been mentioned a few times throughout this presentation. We have there are a number of templates that we'll be providing throughout the next month and a half as we lead up to Knockout Opioid Abuse Day. I think it's important to share just general information about the opioid crisis. I think a lot of us probably on this webinar right now are so immersed in this issue and well versed in it, most likely, that you sort of lose sight that there's probably that we know there's a great portion of the population that still doesn't know some of the basics, whether that's the statistics of some of the tragic overdose deaths over the years, or just the facts about the addictive qualities of prescription opioids. So some of what we'll provide you in the toolkit are fact sheets or templates that you can send out without having to do too much of the legwork. We'll be doing that for you with that. You want to include tips for any emails going out to involved concerned residents, tips on how they can just talk about it with their neighbors and friends, and sort of spread it by word of mouth, which is so vital. There are kind of a few waves to this where you want to get the initial surge from us and the participants in this initiative, but ultimately you want people to feel empowered and knowledgeable about the issue, and to just spread it to people that they know, to talk with it, have those important conversations with people in their communities and families and friends. And then another thing to include in emails are prevention and addiction resources available in your community. Of course, you want people to become more knowledgeable, but if you have, if you're involved in treatment or recovery or prevention, you want to give them, point them in somewhere that they can go if that's something you're involved in, or you know of it in your community. We want to give people that opportunity. It's so vital and a key part of our message on this day.
And
social
Matt,
media.
I'm sorry. I just want to jump in to say, because I know I see on the chat, Ellen from Bergen County and others who are sharing some great resources and information. So absolutely, we're going to have a section on the website that will have all community resources listed by county, so that when people go, they can to the website, they can find information like hotlines, like additional websites, like other information that can help them, additional trainings that may be available. We also have always at the partnership a calendar of events that are going on across the state, and so we'll include that information as well, so that it's kind of one stop for people who are engaged in that knockout opiate abuse kind of activity, or who are aware of it. We want them to be able to come to the website and get as much information and be able to share that with everyone, they know, so continue to see that ripple effect. And to your point, Matt, everything is going to be really, varied, whether it be, who can best, respond to that information, or who needs it. So.
Yeah, thanks, Angela. Yeah, that's so so important, just to provide all of you with sort of any resources, any facts, any information, just in one place, so you can be most effective in sharing the message. To social media as well, we all know how powerful that can be. We will have in the toolkit, and I'll show you in just a few minutes, just some sample posts that you can take word for word and just kind of use it as a template and customize it for your community. Images, like I mentioned, that sort of drive home the point. Some of our past campaigns and just other images that sort of put an idea of what this is all about. Barb, I think, mentioned before that there's, we have a month and a half before Knockout Opioid Abuse Day, but there's a lot that goes into it before then. And so we want you to be active on social media if you can. Starting now, just sort of get the word out about Knockout Opioid Abuse Day, what its goals are, what we want to try to do, and how important it is that we are able to do it, and spread information and about resources and just the nature of this crisis. So with any posts, we'd like you to just tag us on it so we're aware and we can help amplify your message through our social media channels, and that's Facebook, Twitter, and Instagram, all the same tag. You see the hashtags there, which are important to just sort of group it all together. Then we know where to look in the next few months. Post your photos, videos, other examples of how you help spread the word. I mean, that was a little bit easier in years past when you had groups of individuals walk in the streets or posted up outside the Friday night football game. This year, there are ways to be creative with it. So whatever you can show of how you've been a part of this, we always love to see that. That's always such a and gratifying and important thing to see everyone of all throughout the state who's really steps out and does work for this important cause. So that's crucial. And much of what I mentioned for emails and websites and everything else applies for social media as well. We have groups and entities in in your towns, in your counties that are active. They push out a lot of information through Twitter and Facebook. So let's see if you can get them involved in doing the same for Knockout Opioid Abuse Day. So you can see all those groups there that you really want to, when you contact someone from there, say email, website, social media, can you help get this message out through those channels? And I think that's a key way to go about it. And as I mentioned, some of these are posts, examples. This is just participation. Hey, we're going to be involved in this in the next few months. Stay tuned. And these posts will have these available in the toolkit for you. So there are also, the stats and the facts that we want people to be aware of. And again, these are not anything that has to be, set in stone. We want you to put your own, customizable, the importance in your community on it as well. But this is just some way that we can help to steer you in the right direction and give you a little guidance. So again, we always encourage though, just everybody to be as creative for this as they can be. And one other aspect is getting local press involved, and that's this is a big story, and it has been for years. The crisis itself is something that's covered all the time. We hear about new developments every day, but we also throughout the years have had writers, have had people contact us and our participants throughout the state because they like to know what regular people in the community or groups in the community are doing to fight the opioid crisis. And so we'll have media advisories, press releases, sample letters to the editor, which will sort of, again, serve as a template for you to send out. And these have all been successful in the past. And we want to, again, sort of amplify that through the news media as well, that the message that we're trying to get across here. So you can see Natalie's contact information. She's our media coordinator. She can help you out with a lot of this. And again, like I said, it'll be available in the toolkit, which is on the website, which is in progress, but you'll see new things pop up just about every week until October 6th, new resources, new tools that you can use as you participate this year.
Great, Matt, thanks. And again, the website, knockoutday.drugfreenj.org, it's still under construction, but as I mentioned earlier, it's going to have kind of the same look and feel for those of you who have participated in the past, but it's just going to be more broken down to individual audiences. And we're also going to be sending out weekly email updates and to all of you when things have been added to the toolkit, different resources, different information. If something happens that we find out that there's going to be big training events that are going on and we're adding them to our county by county list, we'll definitely share that with you as well. So we'll be keeping you updated more often than in the past, just so that we can all really keep touch. And again, any questions that you have, feel free to reach out to me. You can reach out to Matt, Natalie for specific social media or media questions. But we're here, we all want to work together, and be a resource to you as you do this important work in your community. So I think we have a few questions, but I just want to thank you before we go to those for participating. Again, I want to encourage you, if you have any resources in your community, in your county, to please send them to us at pdfnj.drugfreenj.org so that we can include them as a resource for others who are visiting this site. And again, I thank you for your participation. So a few questions that we had, I really went to the idea of if someone is out of state. I think Barbara, this was, Rebecca rather, this was specifically for you. Those trainings, if they're not in Municipal Alliance or they're located out of state, can they still view some of those resources that you mentioned? So Rebecca, this question was for you. Oh, I think we may have lost Rebecca, but we'll make sure that that information is included in the follow-up to this, the follow-up email about that. But all of the webinars and all of the additional information that the Partnership for a Drug-Free New Jersey has available is available to everyone. And you can view those webinars at knockoutopioidabuse.drugfreenj.org.
Angela, I'm sorry, I was having an issue getting the mute button to click off.
Oh, no.
Yeah, I just want to make sure you all have the JCADA resource. So you can go to www.gcada.nj.org, and you can go from there to Alliance Program. And under Alliance Program, it'll say County Coordinators, and that is where the full list will be for you to get in touch with your county coordinator, who will have access to those webinars that I mentioned earlier on capacity building and so forth. So those can be directly accessed through the county coordinator in each county, and that information can be accessed through our website at www.gcada.nj.gov. Thanks so much.
Great. And so, yeah, a copy of another question we had is whether a copy of the information provided today will be available. A recording will be available, as well as a copy of today's presentation. And we'll link to that in an email that you'll receive tomorrow as a follow-up to this call, as well as all of the other websites and resources that we mentioned. So I just want to mention just one other thing. If you have a committed partner and you feel that you can use paper content, please reach out. And also, if you have an event, if you're doing a series of trainings, if you have a resource that can be shared or would be helpful to be shared on this topic, or whether it's on ACEs or it's on addiction in general or recovery support or stigma, please reach out. We'll be happy to include that as a resource on our website for all, and to really promote it as part of our Knockout Opioid Abuse activities. So I want to thank all of you for participating once again. I want to thank Barbara and Rebecca for joining us, Matt for coordinating this, and really anything that comes up along the way, we're looking forward to hearing from you. We're looking forward to your ideas. Any questions, concerns, please reach out. Everyone, be safe, have a great week. Enjoy the beautiful weather today. Bye-bye.